Hi class, this is our last week, so I'm just going to go over the rest of our reading material and then that would be it for this course. I thank you so much for being part of Aging and Mental Health, and I hope you were able to find this information helpful and productive for your future careers as clinicians. Um, this is the last information, like I said, from the treatment planning book. So I'm going to kind of go over residential issues and then the last few chapters of the treatment planner. And clearly, as we've discussed, there's often like elder abuse that happens in residential facilities. I think there was that statistic that 30% of older people or people who work in some of these residential treatment homes have experienced abuse, which is quite a few people. That's quite astonishing and really saddening. So, as maybe you know someone that's being put in a home or a residential type facility, being mindful of um, some of these factors that you may have to report, or for them to be able to talk to you about these things, and for you to be able to comment on what some of the issues may be. Um, you know, then moving right along, sexually inappropriate behavior. This stuff can kind of happen when someone begins to maybe start to decline, maybe they start to get dementia, some sort of cognitive disorder, they don't see themselves as their age, and then they start acting inappropriately and inappropriately in a sexual manner, which clearly that needs to be addressed because you would hate for someone to assault someone or abuse someone in a certain kind of way. So making sure that you're checking in on what the client's doing, who the client's doing it with, if a caretaker is discussing this, making sure that the proper precautions are put into place so no one is harmed, including the caretaker. You don't want them to be put in harm's way, even if it is a child or a spouse or anything of that nature. If the person isn't in their right mind necessarily, they may not be cognizant of their choices or decisions. So that's something to be mindful of. Sleep disturbance, of course. Again, this sometimes happens just as a change of not doing a whole lot. Oftentimes we've talked about retirement and things of that nature. And some of our clients may have a sleep disturbance because they're not doing so much in their day. Others may be medically induced by some of the medications that they're on. It could be a correlation with anxiety. It could be a correlation with depression. Some of those symptoms are sleeping too much, sleeping too little. So that's something we have to really explore. Okay, what has changed? What is different now? Has a certain situation come up? Did something happen to you? Are you in a residential facility kind of setting, and did someone abuse you in some sort of way? Is maybe trauma from your past coming up that you're now just taking the time to start to deal with? So this is an area where we can really start to explore and really divulge into things maybe a little deeper if something's coming up from their past. It could, like I said, be medically induced. So maybe like we need to again refer to for them to see a physician to maybe address like a medication, or sometimes as you age things affect you differently. Are they eating something that could be causing them a sleep disturbance? Oftentimes sleep apnea comes into play. So, maybe they need a CPAP machine to help them to sleep if there's been weight gain or things of that nature where, you wake up gasping for air. So those are some things to explore. Again, great referral is always to a doctor because there could be something more going on. Somatization. So, someone is constantly aware that something's going on with their body and they think that they're sick. And this happens often with older people just because they're more aware of like the fact that the outcome of something could be death. And so I think sometimes they're overly anxious about every little thing. Um, so much so that it's almost made up, or it's a way of even sometimes getting attention. As families get busy and they get caught up in their own lives, not that they forget the older person that they know, but there can be a tendency to kind of not recognize maybe how much they may need you. So always having an illness or always taking a spill or a fall might be a way to kind of gain some attention. That we've talked about personality disorders. And, some people with certain personality disorders will do things of that behavior in a manipulative way in order to kind of gain perks or attention or get some sort of reward. So that might be something to be mindful of. Um, Spiritual confusion, again, um, as we talked about from even the last discussion board, there's a lot that the end of a person's life brings up. And so maybe trying to get in touch with spirituality for the first time in a long time, maybe them trying to sort through some things, maybe sort through some choices, sort through you know, unresolved conflict, and it might bring up some spiritual questions and some confusion. Maybe they understood things one way, maybe they're starting to go to a different type of church, um, and so they may have a lot of questions, maybe really seeking. As a Christian, of course, this gives you great opportunity to kind of help them to seek and maybe help them to discover some things, and really maybe integrate some things for them, maybe talk about prayer, maybe pray with them in session. It could bring up a lot of things. Now, again, though, if a person is starting to get confused, is starting to show signs of dementia, there might be some confusion that's coming with spirituality just because of the pure fact that they are getting more confused. So being willing to look at some of these things. If someone starts to become very irrational with what they're saying about spiritual things, again, consulting a physician, consulting outside caretakers or family members to see this behavior is really bizarre. What's going on here? There might be more to what's going on than what you know. So just being mindful of those kinds of things. Substance abuse and dependency. We've talked about this a lot, I feel like, over the course of this past year. Oftentimes, we're not necessarily looking for the signs of substance abuse in older people because we think if they're substance abusers, maybe they've already gotten it dealt with. Maybe it's already something we know, but this could be something very easily that could happen after a person retires, whether they get an ailment and they're given a heavy narcotic as a form of treatment, or maybe they have more time on their hands, so they're being more social and they're drinking alcohol, let's just say, more. And someone could very easily slip into this form of addiction, just as anybody else can. It's not something that you plan to do. Like you're not born and are excited about becoming a drug addict or an alcoholic, but it's something that happens very easily. And as we know, with a lot of time on your hands, maybe depressed, it'd be very easy to get caught up in something that you didn't plan on. So we as clinicians have to be very aware of those things. How are you supposed to take that medication? Should you already need a refill? Who else have you consulted about this? How often are you asking some serious questions, because this could result to a harmful consequence, which we don't want that on our hands, of course. And then lastly, suicide. We need to be mindful of things that people are saying, like my life is over. I wish I would just die. I really miss my spouse. I want to be with that person. And really, when they're giving those kinds of hints, giving those kinds of clues, we need to really call them out on it and be like, okay, what do you mean by that? Does that mean you just really miss John, or does that mean that you want to die and be with John? It's okay to be bold and ask those questions because, again, it's your license, your future on the line, the thing that you work so very hard for to get. Don't be afraid. Asking, what is your plan? What do you have near you? A lot of older people have a lot of meds, and that can be a very dangerous thing because, taking too many of those in a very terrible situation. So just being mindful to ask those things is important. You don't want to shy away from it because you don't want to hurt someone's feelings, or you don't want to cause controversy. By all means, cause controversy, because if someone is really going to harm themselves, we need to step in and make sure we take care of that. Again, I'm really looking forward to looking over your brochures. That's just kind of a wrap up really quick of everything. I know you guys have a lot on your plates with the end of the semester. I just thank you guys so much for being so open in your discussion boards and being so real with things that you faced or you've learned with the aging adults in your life, or maybe as you're becoming an aging adult. I really look forward to see how the kind of clinicians you all become. I think you'll do great. So keep up the hard work, enjoy your other classes, and maybe some of these projects that you've been doing, like this handout that you're creating or brochure, maybe save it in your portfolio or whatever, because that might be useful to future clinicians or future clients, or caregivers or whatever that may come across your path. So I wish you the best of luck. Thank you for giving me the privilege of teaching you this semester. and have a great fall semester.